The WHO stated in an initial statement released Wednesday, 24 November, that children and adolescents are at low risk of developing serious illness or death from the virus, and advised developed countries to prioritize supplying vaccines to developing countries rather than immunizing children against COVID-19. Meanwhile, other nations, particularly in Africa, are suffering from vaccine shortages and have vaccinated less than 10% of their people. In Kenya, just 7.4% of the population has received at least one vaccine dose. In Cameroon, just 2.6% have been given an initial shot while just 1.6% have in South Sudan. The WHO wrote, as a matter of global equity, as long as many parts of the world are facing extreme vaccine shortages, countries that have achieved high vaccine coverage in their high-risk populations should prioritize global sharing of COVID-19 vaccines through the COVAX facility, before proceeding to vaccination of children and adolescents who are at low risk for severe disease. Since spring 2021, the United States has been actively vaccinating children and adolescents against COVID-19. In May, Pfizer-BioNTech acquired emergency use authorization for the COVID vaccination in children aged 12 to 17, and in children aged 5 to 11 in October. According to the Centers for Disease Control and Prevention, CDC, 11.5% of 5 to 11-year-olds and 60.7% of 12 to 17-year-olds had gotten at least one dosage. Children and adolescents often exhibit fewer and milder symptoms of SARS-CoV-2 infection than adults, and are less likely to develop severe COVID-19 infection than adults, the WHO noted. Children are equally as probable as adults to contract, although cases in youngsters are substantially more likely to be asymptomatic. WHO wrote that, as children and adolescents tend to have milder disease compared to adults, unless they are in a group at higher risk of severe COVID-19, it is less urgent to vaccinate them than older people, those with chronic health conditions and health workers. The World Health Organization then advised developed countries to prioritize supplying vaccines to developing countries rather than immunizing children against COVID-19. Please leave your comments below on what you think. Also, please like or dislike the video, share, subscribe, hit the notification bell, and be notified when we post new videos. Thank you.